start with a little bit of an intro just to the night. And hopefully, by the time I finish, another minute or two, we'll have some more followers and some more viewers, and we're going to get started. So, I know everybody knows by now, I hope you all know what SBH fertility is all about. But if you are new, I will tell you, and if you're not new, I will remind you that over the last year, SBH Fertility Division has continued to bring hope and healing to many, many, many couples in the community who are experiencing things from infertility, pregnancy loss at any stage, perinatal mental health issues, pregnancy complications at any stage, NICU stays, people who have babies in the NICU, newborns and early labors, and the baby ends up in the NICU. We support them. Anyone who has experienced a birth trauma and needs help healing for the next pregnancy. And not only do we support couples going through this, we also support their friends and family because they need a safety net. And those people also need to learn about what they're going through and what we could do to help. Over this last year, 2024, I'm so proud to say that we have shared in 84 births. Isn't that
Oh, that's
amazing?
amazing. That's amazing.
Crazy, right? Baruch Hashem. So we're very excited. We also have an exciting event actually happening tomorrow. One of our amazing volunteers, Raquel Moseri, will be hosting an event in her home on nausea and extreme nausea during pregnancy. It's going to be featuring a speaker named Shayna Safran, who is from Shifra. And if you would like to attend, there will be lunch, always a catcher, a beautiful lunch and a coffee bar. And if you'd like to attend, please go on our Instagram and look for the flyer for the time and the address. Also, coming up in the spring, we are opening up all of the signups for our many, many, many support groups, which Audrey will tell you all about because she, one of them really helped her, and we'll get to that. But we are opening sign up for our support groups. And springtime is really a time of rejuvenation, self-care, self-help. So if this is something that you think you may need, it's time to reach out and let us connect you with people who could relate to you and join you during your journey. And without further ado, tonight's topic is recurrent implantation failure, when IVF transfers just do not result in pregnancies. And we are so lucky and so blessed to have Audrey Dayan here with us tonight to tell us about her journey. And let's get started. Let's just jump right into it.
Okay. Okay, we'll start. I got married pretty young, thank God. I married Isaac, my husband. I had adorable little girl right away. She was about a year old, and that's it, ready for another one. So I went off birth control, and I did not get my period for quite a few months. I wasn't pregnant, but I wasn't getting my period. So we called the doctor, and he said if we wanted, we could be proactive and we can do a full workup, run all the tests. Part of that was genetic testing. He knew we had a daughter at home. He usually suggests it before they start having children, but he suggested it to us. And
So
we
you
were
had
like,
not
yeah,
done genetic testing.
we did not do genetic testing before. We were like, yeah, I don't know. He offered us a bunch of tests. We said, yeah, throw that in the mix. Slowly, all the results are coming back normal. And a few weeks later, they call us and they tell us that they found a very severe and very rare genetic condition that Isaac and I are both carriers for.
Isaac's the hubby.
Yes,
Okay.
Isaac's my husband. And they proceeded to tell us that there was a 1 in 4 chance in every pregnancy of the pregnancy being affected by this very severe genetic condition. So we did a lot of research, spoke to a lot of people, and we decided that IVF was the right choice for our family moving forward. Isaac had very good insurance at the time through his work that covered a
Very
large
important.
portion. Yes, it covered a very large portion and made it very doable for us.
Okay.
My father actually also had a connection to a very good IVF doctor. So he sent him an email, and the next day during his lunch break, we were in his office. Like, we were
Don't you
prepared.
love those connections?
Yeah, that's like yeah, we've all got them. Sometimes we pull some strings.
You
Okay.
have to. That's the way it works.
Yep. So we went in. He again did a full workup on us, like on his end, and he was expecting it to be easy. I had two kids. Like, no, sorry, I had one. I had my daughter at home. Should be no problem. Then he calls me the next day and he says, "You are not a good candidate for IVF because you're already pregnant."
Wow.
And there is a 1 in 4 chance that this pregnancy is very affected and you need to think about what you want to do. We decided to do a CVS test. It's basically an amnio, just a little bit earlier, and it'll target this genetic condition. It was a very scary 3 months, but thank God we tested and the baby was healthy. And 6 months later, I had a delicious little boy.
Wow.
So now I have a little girl and a boy at home. He's a 1.5 years, and that's it. Ready for
You're
another. Doesn't stop.
on the
Keeps going.
schedule. Two
Yep,
years.
keeps
2 years.
going. Um, so we go back to the doctor and we get ready to start. And again, he tells the same
Start
thing, like, should
IVF.
be easy. Yes, we're ready to start a round of IVF.
Okay.
Now, the way it works is that they retrieve eggs. So they stimulate a lot of eggs to grow. They retrieve them all. Then they fertilize them. They have to last 5 days. They freeze them. In my case, they send them for genetic testing to target this condition and also make sure the chromosomes are normal all around, not just my condition. So we do the first round
I
and
just want I'm sorry, I want to just clarify this for everybody watching. At this point, we're sending embryos, fertilized embryos, to be tested for the genetic. We go from the egg to the embryos, and this is what's sent for genetic testing to see what is viable for an IVF transfer. I'm sorry
yes.
to interrupt
No,
you.
no problems. So we we retrieved 19 eggs, which was a great number.
Beautiful.
And along the way, we lost a few every stage, and we ultimately ended up with 3 viable embryos. Now at this point, I'm like, okay, I have 2 kids at home, 3 good embryos. Like, I guess I'm having 5 kids, you
Right.
know?
It's gonna
Um,
happen.
um, we go to transfer the first embryo. They put the first embryo in me, and it totally doesn't work, fails. The doctor tells us it's normal. In a perfect scenario, there's only a 60% chance that it's going to work. Don't worry, try again. Okay, so what do? We try again. We put in another embryo, and they call me and they're like, "You're pregnant." And I said, "Of course I'm pregnant. Like, I had 2 kids, of course." You go in every other day for blood work to make sure that the HCG doubles. The pregnancy hormone has to double every other day. So I'm going in, not thinking much of it. About a week and a half later, they call me back, and the doctor tells me that the pregnancy hormone is dropping. And at this point, it's not a viable pregnancy. It's not a miscarriage because it was too early. It was a chemical pregnancy. Basically, I was pregnant, and then I wasn't anymore.
So funny. I
Okay, what?
always like I know it's like a silly thing to say, but I always feel like a chemical pregnancy is like poof, it's gone. You never,
Yeah.
it's such an odd phenomenon. Okay, keep going.
Um, so then we had one more embryo from this round. So we said, okay, put in the last embryo. Put in the embryo, same exact thing. I was pregnant and then I wasn't anymore. Numbers dropped, it wasn't viable. That's it. Now we have no embryos left.
And what's going on? Like, just stop for a second and tell me what's going on in your head, what's going on in your home, what's going on in your marriage. You have 2 children, you have 2 little children home. What does this look like? 3 failed implantations. Well, 2 were successful, but led to still nothing.
Right.
What's going on?
So we were not expecting it. It was like totally out of the blue. We thought it was going to work and we didn't know how to handle it. There was actually funny, but I mean, not so funny, but funny for now. Story that happened in the summer. This was around the first chemical pregnancy. We were in the deal house. The kids came home from camp. And I'll tell you something about my husband, Isaac. He is like amazing. He never loses his cool. I'm not like that. He's like, I'll yell at him. He's totally cool, calm, and collected. He will do anything for his family, and he's an amazing dad. Um, and the kids
It's
came home
so
from dance.
nice.
He's amazing. He's amazing.
Isaac, if you're listening, she deserves a present. She just gave you a big shout out.
He should get a present. Um, so the kids are, we're showering the kids. We just found out we lost an embryo and we are like going at it. We're attacking each other. The kids are crying. The shower's boiling. No, just get in the shower. Me and Isaac are yelling at each other. We're yelling at the kids. We're a mess. We don't know how to handle. And
Okay.
my mom lives across the street in Deal. And she thinks it's a great time to come drop off like a dumb plaid or something stupid. And she walks in, she sees us going at it, and she's like, okay. And that's it. She drops it off and she leaves. And she called me the next day and she just said, Audrey, you and Isaac are amazing together, but you don't know how to handle this. This is something you weren't expecting. You're only married for a few years now. You're not prepared for this. And I don't know how to help you. I know you need help, but this is not something that I can do for you. I mean, I agreed with her, but we didn't know what to do with that information. So we kind of tabled the discussion. Like within a week was the SBH fertility event in Lawrence Avenue Shul.
Yes, our kickoff.
Yeah, I saw it
That
on
was our first
Instagram.
event.
I didn't know really much about it. I saw it on Instagram and I thought there was gonna be like 10 women there. I was not expecting. I said, let
400.
me go. Let me go. So I went alone. And it was like I was listening to the stories of these women, and it was like my loss. Like I was listening to my story. And I got home and I said I have to call them. Like this is what my mom's talking about. But I couldn't make that phone call, so I decided to send an email. That phone call was way too hard, so I sent an email. And the next day, Michelle called me back. Shout out to Michelle, if you listen. I'm sure you're listening. She called me back, and she just, first of all, just talking about my story really helped. At this point, really nobody knew. We thought it was not going to be a big deal, and she put me in a support group. And that's it. I was in the system. I was in the SBH system.
You were in the SBH family.
Yes, I was in the
Different.
family.
You were
Yep.
in the family.
So now there's really not much else to do. We move on, try again.
I want to actually stop you for 1 second because you said you sent an email. And I just want to tell everybody that sometimes the screen is a good barrier. When you're embarrassed to make a phone call, shoot us an email, shoot us a DM. We see it. And if you can't pick up the phone, we get it. And obviously other people get it too, as Audrey did. And it's just there are other ways to contact us if you don't want to make a phone call. So I just want to say that.
Yeah, the phone call is very hard, but the email was more doable.
Okay.
And that's what worked for me. So
Let's move on now. Like
yeah,
what's next?
I'm
Round one of IVF.
ready for
Nothing
another
worked.
round. Ready for another round. We go in to do another round of IVF. And we come out from the retrieval. They got a little less than the first round, but we got some eggs. And ultimately, we ended up with no embryos from this round. So it was like a huge blow. I was like numb to bad news already. I felt like it's not going to work anyway. And at this time, my husband's insurance changed and we lost IVF coverage.
That's huge.
It was major. We didn't know what we were going to do. You know, you're asking us to throw our resources into something that's not working.
Right.
And we shared this with the doctor and we said, we need to take some time to decide how we're going to move on from here. And our doctor actually called us back a few days later and he offered us to be a part of this fund that he has set up. People donate to the fund and it's at the doctor's discretion who he thinks is a good candidate, but is in a situation like ours where they can't fathom paying the full thing. And he's going to put a large portion of money from the fund into our cycles and pay for
That's
our
incredible.
IVF from the fund. It was amazing. It was so encouraging. At this point, we had our families behind us. Everybody was very supportive that knew about it. We had SBH. I was already, with them. They were sending us out for dinner. They were giving us desserts, and Michelle was calling all the time. Now I have the doctor who believes in what we're doing and believes in the success of it, that he's willing to give us from his fund. And we had just regular people who believe in the success of IVF to donate money to his fund for somebody they don't even know, but they believe it works. It was like
Guys,
incredibly encouraging.
I just have to say that whenever you're considering making a donation to a fertility organization, you literally could be the reason why someone decides to continue to grow their family. And this is a nice example.
Yeah, it gave us a lot of encouragement to keep moving. And we were like pumped. We're ready to go again. So we go in for another round of IVF. We go in, we ultimately end up with one healthy embryo from this round. We put it in, doesn't work, totally failed. I was a mess at this point. I was a total mess. I was crying every night. I held it together for my kids, but the minute they went to bed, I was just a disaster. I don't even know who supported my husband during this time because it was not me. He had to have the strength for the both of us because I couldn't do it. And
You had like a whole surge of energy when the doctor really was batting for you and offering you the funding, and now it's just what a letdown.
it was very hard. It really hit me hard. SBH actually, at this point, they set me up with a support group. It was not even women who were doing IVF. It was in a live secondary infertility support group run by Andrea. And it really helped me at this point. It was very encouraging to talk to other women who were going through similar experience, not exactly the same, but oh my God, my cousin said this to me. Oh, I heard that too. It was very encouraging, and it really helped me get through this loss.
How was it getting that phone call at the end that it was a
Um,
fail?
well, I'll be honest with you. Don't do this. Anyone listening, don't do what I did because they tell you
What
not
do
to.
you-
They tell
Okay.
you not to. I actually took a pregnancy test before the doctor gave me that call. I know they say not to do it because it could be wrong. And at this point, I was getting so much bad news, and I couldn't. I needed to give myself that time to mourn the loss of my embryo on my own time at my own pace, and not while I'm out in the supermarket getting
Right,
a phone call at 11
right,
o'clock. Oh,
right,
you're not
right.
pregnant. Um,
You were protecting
yeah,
yourself.
that was the way I was coping. I
Okay.
also,
In
um,
hindsight, since they tell us not to take tests, what would you tell yourself to do while you're waiting for the phone call
um,
to protect yourself?
one day at a time. Just take it one day at a time. Do whatever it takes to just make it to that next day. Um, I was, like I said, I was just crying every night. So we put a TV in our room. And instead of crying every night, I just watched something dumb. I just shut off my mind, and it got me to the next day. That's all you need. Just keep moving.
Day by day.
Yeah.
Okay, so
Um,
what happens now?
now we move on. What else are you supposed to do? We do another round. And we get two embryos. I'm still a mess
Two
at this point.
two viable,
Yes.
genetically tested, healthy
Yes.
embryos,
Yeah.
correct?
Along the
Okay.
way, we lost some. We started out with more. We end up with two
Okay.
viable embryos. At this point, we were talking to a lot of rabbis and people along the way to just help us. And one rabbi suggested we go to Israel. And our families were amazing. They really pulled together to help make it happen. And within a week, we were on a plane. We go to Israel. We're praying. We get blessings, the whole shebang. And we come back, and we're ready to put in an embryo.
Now you have the
Um,
spiritual
yeah, well,
surge.
I'm like pumped. I was so religious. It's gonna work. Um, and they call me the night before and they tell me, I'm sorry, but the embryo did not survive the thawing process. And I'm like, okay, it's fine. Like, I'm feeling
You have
great.
another
I'm like,
one.
yeah, it's fine. Use the other one. It's fine. It's gonna work anyway. Um, put it in, and it doesn't work. And the doctor calls us in and he tells us, I'm so sorry, but there's nothing else I can do for you. And it's like, where do you go from there when the doctor, who's supposed to be the pro, is telling you he can't help you anymore? We were lost. This was right before the summer, so we decided to take the summer off and we did a lot of consults. We spoke to anyone we could get in touch with. Um, we ultimately ended up switching doctors just to the doctor who had the most ideas for us. The problem was that we didn't have insurance coverage and we didn't have the fund from the other doctor. At this point, we reached out to SBH again, and like from this angle now, and they suggested we contact two other amazing fertility organizations in the community, and the three of them together pulled enough money for it to be manageable for us.
That's amazing.
It was amazing, and it allowed us to keep moving. So we start with a new doctor. He tells me that he wants me to test my fallopian tubes before we start. No one ever thought to test it before because I had two healthy pregnancies, and no one expected it to be a problem. So I said, okay. I go in, do the test on the spot. The technician tells me everything looks great. I'm like, oh, okay, I guess that's not the problem. The doctor gets the
It's so
results like,
frustrating when you're searching for a problem. So, like, it must be
you
so hard.
want, yeah,
You
you
want
want
an
to find
answer. Tell
something.
me something's wrong.
Yes, you want, but you don't want at the same time.
No, and
It's a
just
mind game.
as women, we are fixers. We need to know what the problem is so we can fix it.
Yeah, it was I was expecting something to be wrong, then it wasn't. I'm like, should I be happy? Should I not be happy?
Oh,
Okay. So now the doctor looks at the scans and he says, I don't know. I feel like it's something a little off, but not I can't tell. Speak to the specialist. So we speak to the specialist and he says the same thing. If this was the beginning of your journey, I wouldn't even think anything of it. But because of your losses, I think we should do exploratory surgery and see what's going on. So we do. Um, I go in for the surgery. I wake up and they tell me, the doctor comes in and he says, we found an infection in both of your tubes. We were able to clear it, and it's possible that this was the reason why IVF wasn't working. Now, the recovery from this surgery was brutal. I was basically in bed for 2 weeks. IVF bypasses the fallopian tubes.
yes.
You put an embryo directly into the uterus. You don't need tubes.
Right, so
So
should this shouldn't even matter.
it doesn't matter. Like, what's the big deal? So what? Why is this an answer? It was not encouraging.
Right.
But the doctor tells me he sent a
Yeah, I lost you. I lost you.
oh,
Okay,
on there.
now I hear you.
Um,
Sorry.
no, so the doctor tells us that he sent a piece for a biopsy, but you know, keep going. Okay,
Okay.
we do a retrieval. We start another round of IVF, and we end up with one embryo. Now we prepare to put in this embryo, and the results from the biopsy come back that it was an infection, and the infection, it's possible that it was slowly leaking fluid into the uterus, and basically the embryo needs to stick to the wall of the uterus, and if there's
Right.
anything blocking it, it doesn't stick. um, but you can't see it on any scans or anything, so we think this is it, but we don't know. Okay, all right, just keep going. Put in the embryo, and they called me back and they said it worked. And I said, okay, for now. And I kept going in, and the doctor kept telling me one day at a time, one day at a time, until we heard the heartbeat.
Mm.
And a little bit earlier than expected, but we now have a 6-month-old delicious little baby boy from
Wow.
that last transfer.
Wow. 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 That is such an amazing, incredible journey. Um, I counted along the way. You had 7 genetically tested viable embryos, and you got one, Baruch Hashem, beautiful baby boy out of them. But that must have been a very difficult journey for you or anybody that's going through something similar. So tell us, just give us a little chizuk, give us a little advice. What do you tell a girl that's watching and sharing in your pain?
So I want to point out, first of all, that, we run through it in 20 minutes, but this entire thing took us about 4 years of
Wow.
like real real pain and suffering. It was very hard. Um, the first thing I would say is that, like we touched on it earlier, send an email, reach out. It's like when you're suffering, it's like you're drowning and you need somebody to pull you out of it. If you know me, send me a text, reach out to a friend, call
Yes.
SBH, call the professionals. They could literally help carry you out of it.
And by the way, what a mom. Kudos to your mom. She didn't butt in. She knew she couldn't help. It wasn't her wheelhouse, but she pushed you, right?
Yeah, my parents were incredible this entire experience, and they 100% supported us,
She sounds
whatever we decided. And
amazing, even though she
she was
came
amazing.
uninvited with a platter. Like,
I laugh now. It wasn't funny at the time.
Mom, I hope you knock. But really, to just know that something's off or something's wrong and say, I'm sensing something's wrong, I can't help you, but to push someone towards the right help, that is help in and of itself.
Yeah, that was amazing. Um,
It looks like your
something
mom
else.
is getting a lot of love in the comments.
She deserves it. Um, something else that I would say, along the way, I really always believed when it's the right time for me to have a baby, Hashem's going to give it to me. And I used to make up these crazy ideas in my mind. Why didn't this embryo work? I don't know. Maybe this grade wasn't good for the baby. Like I made up these insane thoughts just to help me try to understand why it wasn't working. But like, it doesn't help. It doesn't help you. I would try to pray and I couldn't even I would open this door and I would just cry. How many times are you going to ask for the same thing? We're talking 4 years. I'm going to ask for the same thing every day. That doesn't, I'm not seeing any results. And I would say to anyone who's going through this now, just connect to God in whatever way you can.
Yes,
It
and
doesn't,
even crying is a connection. Crying is prayer. Crying is pain. It's okay.
yeah, it doesn't have to look the way that we're taught in school. It doesn't have to be like that. Just connect in the way that you can to get you through. Um, anyone who's going through this now, look, I was you. I was there, and I couldn't even see getting out of it. There were so many times where I turned to Isaac and I said, I can't do this anymore. I'll just accept the fact that I have two children and it is what it is. And he knew that I really always wanted a big family. And he just used to tell me, if you quit now, you're going to regret it in 10 years and in 15 years if you didn't do everything that you could, because I know what you really want. So anybody who's going through a lot of loss after loss and you feel like I can't
It
do
is
this
a
anymore.
loss. It really is a loss. It's the right word. Even though it was an embryo that didn't implant, we didn't hear a heartbeat, we didn't see it on the screen. It's a loss. It's the loss of a life that you were imagining could have been.
Yeah, you plan for things and you have high hopes for your families, and those dreams change based on your experience. I never thought I would have a 6-year age gap between my children. Um, but just keep going. Don't give up and find a way to go day by day by day, because in the end of the day, after 4 years, I get to hold my baby and kiss my baby, and I hope that you'll get there one day also, and
Amen.
you won't look back and regret. Keep going.
Just
You
keep
won't
going.
regret the persistence.
Keep going. And we don't need to tell you again that SBH is here for anything that you need along the way. Um, do you have anything else you want to add?
Um, everybody's support looks different in their journey. A lot of people have amazing families. Some people don't really rely on their families, they rely on their friends. Every support system is different. My family, our families, really, Isaac's parents also were really pulled us through. Um, our our doctors, both doctors, had a lot of hope in us and really encouraged us. Um, and SBH, Michelle and Andrea were very helpful to us, and there were a lot of people behind the scenes, I'm sure, that dropped me off dinner when I was doing a retrieval, and sent me desserts for Shabbat, and a lot of people that probably know my name and I don't know theirs, and I just want to thank them for volunteering their time and for helping us, because it really helped us through. And I'm just so grateful to God that we can look back at the family that we have now, and it's like we're at the other end of it and we made it. So
That's amazing. I want to thank you so much for opening up and sharing this story. It's a really, really important topic. It's a topic that really pertains to loss in its own way. And thank you for all your advice and all your insight and sharing with us all your raw emotions. And enjoy that little baby. And we're actually, everybody, we're going to bring on Dr. Zev Williams to continue the medical side of this discussion.
yes, thank you.
Um, Thank you. And I'm going to
Okay.
get him on. I'm still here. One second. Just want to tell you a little introduction. I'm going to do it before he gets on because then it might be awkward because he's so awesome. Dr. Zev Williams is the director at Columbia University Fertility Center. This fertility center was ranked by Newsweek as one of the top two centers in the US. They have a location in Columbus Circle and in White Plains. And we are very, very, very fortunate to have him tonight share on this topic. And I'm seeing someone in the comments ask if they can ask questions. There is a question box at the bottom. If time allows us to, we would like to get to your questions. So without further ado, I'm going to accept him in the live. Just give me a second. I feel like I need some music, like hold music, because it's not working again. Hold on. Oh, here we go. Hi.
Hi, can you hear me
I had to
okay?
give, yes, I had to give the little intro without you. Tell everybody
Okay.
how amazing you are.
Well, it's kind of you. Thank you. It's nice to see you. This is such a special event that you're running. And, I was listening to Audrey before and talking about how she was able to use email to connect with you. And it was striking to me how even this event, to use Instagram Live and how you're using technology in all these different ways of helping something that's so emotional and so fraught with stress and anxiety and worry, to find new ways to connect with people, and to find new ways to help create that SBH family feeling, and really help people through what's such a heartbreaking, difficult period. So just wanted to really commend you and thank you for that.
Thank you. We appreciate that. So thank you for joining us tonight on recurrent implantation failure. And I'm just going to hop right into it. I'm going to ask you a question and then you take it away. And feel free to add whatever you want to it. We really appreciate you being here tonight. So something that just struck with me, and then I felt like I pretty much understand it, but I think that our listeners would like to hear more about it. Maybe you could give us a very brief overview of IVF, and then Audrey kept on saying how she retrieved 18 eggs, 19 eggs, 20 eggs, and then ended up with zero viable embryos, three viable embryos. What happens along the process that makes those numbers decline so much?
Yeah, two really great questions. And you really hear from Audrey's story what a heartbreaking journey this is, the emotional roller coaster that it could be. Sort of it's to start off where it's so easy sometimes to be able to get pregnant and then to have this genetic news and then all the setbacks. And, there's a bit of misnomers in the area. And I like the term pregnancy loss that she used, because even when we talk about, we use that term biochemical pregnancy, which for your listeners simply means that you have a blood test or a urine test showing that you're pregnant, but you don't see anything on ultrasound. The reality, though, is as soon as you get that positive pregnancy test, it's a real pregnancy to you, and you're
Yes.
imagining, the birth and all the anniversaries and the celebrations and the birthdays coming up. So it is a pregnancy, and even with the transfer, that embryo that you see being transferred when it does an implant, that is a loss. So I think it was really a needed sensitivity to that. IVF stands for in vitro fertilization. And basically, from a normal fertilization, sperm and egg meet up in the fallopian tubes, and the fertilization occurs there. That's when the sperm and egg come together, and then it travels through the fallopian tubes. And about 5 to 6 days after fertilization, it enters the uterus and implants in the lining of the uterus. That's how every pregnancy occurred from the beginning of humankind until about 44 years ago. After that, they developed a new type of fertilization called in vitro fertilization, where instead of the sperm and egg meeting in the fallopian tube, the eggs get retrieved using a procedure and fertilized in the lab. And the embryos then grow in the lab and could then be put back into the uterus. So as you mentioned, you sort of bypass the fallopian tubes by doing it. And that's why IVF started. IVF started to help what's called tubal factor infertility, which is when there's a problem with the fallopian tubes. It could be that they're blocked, or as in Audrey's case, they don't necessarily have to be blocked. Sometimes it's even worse when they're not blocked, and fluid they could produce spills back into the uterus.
Okay.
So that's how IVF started. Then it's advanced to be able to help not just in those cases, but in male factor, where there's instead of having hundreds of millions of sperm, there might only be a few sperm. And you could take those individual sperm and place them right into the egg and then put the embryo inside. And then one of the more exciting new opportunities to help has come with what Audrey was doing too, which is called pre-implantation genetic testing for monogenic diseases. So all the diseases you would have heard of, things like Tay-Sachs and Canavan's and Gaucher's disease, as well as ones that you may never have heard of, and ones where it might be that couple are the only two people in the world who carry those mutations. You can now do IVF and you grow the embryos. And before you put them back into the uterus, you do a biopsy on the outside of the uterus, so the part of the embryo that will become the placenta. So you take about 5 cells out of the embryo. At that point, the embryo has hundreds of cells. You take 5, you send those for genetic testing, you get the results back, and the healthy embryos you could put back in. And if you have extra healthy ones, they could be frozen for the future as well. So that's a little bit about IVF.
Okay. So how did she lose so many by the end?
So there's a natural attrition that will happen. And I think when you think about pregnancy, when you learn about magic, you learn how a trick is done. You're like, oh, okay, that was interesting. When you start to understand fertility and at deeper levels, it gets more and more incredible and remarkable the more deeply you understand it. And you really see how every pregnancy is such a miracle. And the number of steps that have to occur properly for any pregnancy to succeed. It's really quite remarkable. And that amazing number of steps doesn't just begin once the woman's pregnant, it occurs even before. So from the time that a sperm and egg come together, there's a whole host of factors that have to go right to allow the embryo even to progress to the point where it could be put back into the uterus.
Hmm.
And those factors are partially related to the egg, but they're also related to the sperm. And I think that's one area where there's a lot of misconceptions. Everybody assumes it's primarily egg factor or uterine factor. It actually, in cases where we're able to identify the cause, and about 40% of the time, it has a sperm factor to it as well. And the sperm, know, when the egg and the sperm come together, there's a lot of work that has to happen in those 5 days. So you go from basically being one cell, right? The sperm and egg come together, you've got one cell. 5 days later, you've got hundreds of cells. The embryo is hundreds of cells. So in just 5 days, there's all this development that has to happen. That's a huge stress on the egg and the embryo. So certain things like having extra or missing chromosomes in the egg can cause the embryo to arrest and not make it to be transferred. But there's also cases where there's problems in the sperm, specifically what's called DNA fragmentation. So sperm DNA fragmentation. The sperm could look normal under the microscope. So in a regular semen analysis that's done to test for causes of infertility, you look at the motility of the sperm, the volume, the concentration, the shape, and that predicts the ability of the sperm to fertilize the egg. But like we heard with Audrey, that's just one part of the process. What also happens is what happens after the sperm fertilizes the egg. And you can have a condition where the sperm could look completely normal. The semen analysis could be completely normal, but there's breaks within the DNA of the sperm. So that after fertilization happens, the egg and now the developing embryo has to fix all these breaks. That's an enormous strain that's on the
Wow.
embryo. And so sometimes those embryos will continue to rest. It's actually good to identify that for 2 reasons. One is for the fertility purpose, which is why we're talking about it. But the second is a lot of times things that cause DNA fragmentation in the sperm are actually not good for the man's longer health, for his
Oh, wow.
long-term male health. So identifying that actually helps. In some cases, we've been able to catch cancers early, but in other cases, that's rare. But in other cases, there's certain factors affecting the testes that could decrease the ability of the testes to function normally decades later. But when you can identify it early and correct it, you could preserve that function later.
Wow. So a lot has to happen to get from A to Z.
Yeah.
And along the way, it sounds so, but now Audrey had all of these genetically tested embryos that were deemed
Right.
viable. So I guess there's no fracture genetic DNA. The
No, that
DNA.
is we call it DNA quality. It's
Okay.
sperm DNA quality. So the
Okay.
test we do on it is called the sperm DNA quality test. It's an easy
Okay.
thing to do. It's a sperm drop off and you get the results back the next day. But
Okay. So now all of these embryos are good to go. Why wouldn't they stick in her? Well, we know now why they didn't stick for her, or we think.
yeah.
But in other women, why do transfers fail?
So there's a few things. First of all, just to correct, because what you just said is a very, very common misconception. When we
Okay,
test
correct me.
embryos, I'll modify.
It's okay.
When we test those embryos on day 5, we're counting the number of chromosomes that are there. And you're looking at whether there's extra or missing chromosomes. Or in the case of Audrey, testing for a specific disease as well. It's not looking at whether that DNA is fragmented into little pieces. So you can have, for example, a volume of books where there's an extra volume or a missing volume. That's what the testing is looking for. But you can have the correct number of books, but they're shredded into a lot of pieces, but you'll have the correct amount of material there. So the testing that's done on the embryos, when we say that they're normal embryos to transfer, it just means the amount of DNA is normal. It doesn't mean that it's not
Okay.
fragmented into little pieces.
Okay. So that could cause a transfer to fail.
Right. So a transfer to failure, Audrey had two things happen. She had embryos that were transferred and didn't implant, and she also had ones that implanted
Right.
but then failed shortly afterwards. What's
Right.
very counterintuitive is that the first implantation failure is actually very, very common, bordering on expected and normal. The second is not.
How
So in a case,
many have to, I'm sorry to interrupt you, but how
yeah.
many have to occur? How many implantation failures have to occur for you to think that there's more to look into?
Well, I think very early on when you transfer, you always want to look back and see if there's anything that could be done differently, anything that could have been done better. But one of the big challenges with that is you don't want to make the mistake of changing to something that's actually worse. So you could have been doing the perfect protocol, the perfect transfer protocol for the patient, and it just was this case. And as you mentioned, about 60% of the time the embryo will implant, 40% of the time it won't. And there was a great study that was published just about a year ago where they looked at over 4,000 embryo transfers where everything looked normal. 60% of the time the embryo implanted, and they looked what happened in that 40% of the time when it didn't. They did the exact same cycle again. And again, of those patients, 60% implanted. So that's sort of the ballpark. And you don't want to shift to something that is actually going to decrease your chances of getting pregnant. So that's implantation. Once an embryo is implanted, though, and it's a genetically normal one, the chances of it miscarrying are actually normally going to be very, very low. And it suggests that there's something else that's going on that's causing that embryo that's implanted to not be able to progress. And it probably is a spectrum from implantation failure to biochemical losses to early losses to later losses and even stillbirth and preterm birth.
Hmm.
And thinking about what it could be, like, because that's, and in many ways, the hardest thing for a patient to hear is that all the testing came back normal. Everything was
Right,
fine.
right,
It's
right,
so it's so counterintuitive, but you test, you don't have this problem. You don't have that problem. It's hard. It's hard because then it's like, there's something going on.
right.
What is it? It just means it's harder to find. That's why the detective work, that really trying to be comprehensive about is so important. But a way that I like to think about it is that there's sort of the environmental factors, things like the uterus and inflammation, the immune system, and then there's embryo factors, which can have to do with the egg and the sperm, and even the way the embryos are cultured and the stress that we put on eggs.
Is there anything we could do for the environmental factors to make our chances higher for a positive transfer?
So the answer is yes and no. So the most basic things that people could do, there's a whole industry that's sprouted up with supplements and these high dose nutrients that people could take. The data is pretty clear that things like a Mediterranean style diet, trying to cut out processed foods, added sugars, having extra virgin olive oil in your diet, 1 to 2 tablespoons a day. Those are things that you could do that are helpful. Maintaining a normal body weight is important. Having, as best as you can, avoiding smoking and those sorts of things. Most of the times, especially when you hear some story like Audrey, that's not the issue. That's really
Okay.
not what it's been. The environmental things are things that you have to work together with your doctor to try to identify what the cause is. It could be issues with the tubes. One classic thing that we see is with an isthmus seal. So a classic presentation of that is a patient will have had no problems getting pregnant, could have a healthy delivery, might have had a C-section, suddenly can't even get pregnant again. And sometimes when a C-section is done, it could be done a little bit low, and you create a little defect where the cervix and the uterus meet, and that fluid, we were talking before about the fluid from the fallopian tube going into the
Mm-hmm.
uterus. You can also have the fluid from the cervix going up into the uterus. And all those things have the same effect, which is to create an environment that's not hospitable. So you want to evaluate to make sure that the tubes and the uterus have healed well. You want to make sure there's no inflammation inside the uterus. Test the immune system. Immune dysfunction can make it difficult for an embryo to implant or cause it to fail early. And to look at the lining and ways to modify the cycle, doing things like a natural cycle. And there's interventions too, things like PRP, platelet-rich plasma, which we know in recurrent implantation patients, failure patients, could double the chances of implantation. So those are all things looking at the uterus.
And are these all things that a doctor that you trust thinks of? Because I would never ask these questions going through the process. I don't even know what half these terms mean.
Yeah, it's sort of within the fertility world, there's sort of, there's people who focus on that, there's ones who will do, genetic testing for genetic diseases. There's people who do egg freezing, and then there's people who will really focus on these implantation failures and pregnancy loss failures. So it is important. The basic things I think everyone will do, but when those aren't working, it is important to find someone who sort of focuses a lot more in that area. And
Mhm.
that's just dealing with the uterus and the environment. For the embryo itself, I mean, this is one of those areas where you see the difference that in terms of the quality of the lab to create the best environment for the embryo and things you could do to actually decrease the stress on the embryo. So pushing an embryo to day 5, for example, is necessary if you want to do genetic testing on it. But in some
Right.
cases, you don't. You don't have to do genetic testing, in which case letting the embryo just develop to 3 days and then allow it to go into the uterus is helpful. I think I think we have one of the best labs in the world, but it's still not as good as inside the woman's uterus.
Right.
So if an embryo doesn't have to be pushed longer, it doesn't have to be stressed longer, and we can get it back into the uterus sooner, that's a good thing.
And when you say stress on an embryo from a lab, how do you feel, or what could you tell us about just general stress on a woman? So many highs and lows and emotions, and the stress is sky high. How does this play a factor?
Well, it's a there's a challenge with answering that, and you don't stress is never good. It's a terrible emotion to be experiencing, but I don't want people to be stressed that their stress is causing problems because
Okay.
nobody wants to feel stressed, and then they won't sort of saying, "Oh, me feeling so stressed is bad. I'll stop being stressed and be relaxed now." If anything, it sort of spirals the other way. And
Right.
the good news is that we see, even in cases of very extreme stress, it doesn't seem to play a role with pregnancy loss.
Oh,
Where it
okay.
does play a role, where it does play a role is that the body, if it feels stressed, doesn't really have the ability to sort out what the cause of the stress is. So historically, stress meant you couldn't get enough food, you couldn't get enough calories, you were sort of under a life-threatening stress, in which case it's not a good time to get pregnant. And so the body's response is that ovulation will stop. And that's why you see, for example, long distance runners are often, they lose their periods
Yes.
because their body
Yes.
experiences that kind of a stress. You can't tell what it's from. People will also, when they're having stress from work or from life and other things, that's one of the things that will go because the body's just saying, oh, there's some sort of a stress going on. This probably isn't a good time for me to be getting pregnant right now. But
So it's almost like your body is
your
protecting yourself.
body's protecting itself. Let's wait till it's a little bit better. In the same way, actually, that you see when pregnancies are genetically abnormal, meaning extra missing chromosomes, the vast majority of times the pregnancy will fail. And it's often the body's way of stopping that pregnancy to protect the woman.
So
So
you're
there are
talking
these
about
safety
a
mechanisms.
miscarriage.
I'm talking about a pregnancy loss or a
Okay.
miscarriage. Yeah.
Okay.
So that's from the genetic side of it. But when you do things like an embryo transfer, oftentimes the way it's done skips over the way that stress would be impacting it. So if there's
Uh-huh.
things that you could do that will reduce stress, meditation, mindfulness, davening, whatever it is for you, that's a good thing. But I don't want people to think if I feel stress, if I have a deadline at work, if I get into an argument with my spouse, that that's what caused the pregnancy loss, that's what caused the biochemical, that's what caused the embryo to fail to implant.
Because there is a lot of guilt, and sometimes we impose it on ourselves and we take blame for things that happen. So it's good to know
There's
that we
a
don't have that much control.
there's a tremendous amount of self-blame and guilt. And one of the things that's so difficult is for a lot of other medical conditions, there's less of a stigma about discussing it and sharing it. With fertility and pregnancy loss, there's still a lot of a stigma. You and your organization, and even within the whole community, there's been great progress in terms of removing a lot of that stigma and self-blame, but it's some of it still.
I lost you. Do you hear me?
People aren't always feeling comfortable sharing. And when they don't share, that means they can't get this kind of a support. And it's a tough thing to have to go through alone with just you and your partner. And both
Hmm.
people, with pregnancy loss, both people really are affected on this. The whole family
Yes,
can be.
yes. And as far as time-wise, what do you recommend after you have an implantation failure? If you have more embryos frozen, how long should you wait to implant another one? Or if you have none frozen, how long should you wait to start another round of in vitro?
It Part of it depends on where the person finds themselves emotionally and psychologically. Are they ready to go through this again? For many, getting back to that next cycle, that next transfer right away is very helpful and very therapeutic and very healing. And sort of having to sit and pause is tough. After pregnancy loss, you really the medical answer is that you need everything to reset. In cases of something like an implantation failure, the body's reset the next cycle.
Wow, okay. So not
So
that
if
long
someone wanted
medically.
to, right, if everything looked perfect, if the lining developed perfectly, there's no other issues, if the whole work had been done, you do one transfer, it fails, you can go right in the next month to do another transfer. In cases of a pregnancy loss, you'll want to make sure for the pregnancy hormone to resolve. And then I really recommend you have a careful evaluation of the inside of the uterus to make sure there's no retained tissue, there's no scarring, and there's no inflammation.
So as a
Once that's
oh,
cleared,
sorry.
no, go ahead.
No, it's okay.
I was just going to say you want to make sure that all that's reset because sometimes someone could have a loss that was genetically abnormal and be like, okay, well now we understand why that last loss happened. We can just go forward now, and hopefully that won't happen again. But that genetically abnormal loss can sometimes cause a problem in the uterus that can cause a genetically normal pregnancy to fail.
Oh,
So
wow.
having that kind of a careful evaluation after a loss is important.
So after an evaluation, if the doctor deems it medically healthy to continue, do you find that emotionally it's best to just keep trudging through it and keep going?
Yeah, I mean, I think some people need it, it really varies. I mean, this is one of those things where you have to really partner with your doctor because from a medical point of view, to wait a month, to wait a cycle isn't going to be problematic. When someone's older, like in their 40s, yes, every few months really does make a difference. But if this is something that you need to heal, that you need to take a little break, Audrey went to Israel for a little bit, like those kind of things, that can be helpful and important to being able to get through the process. But from a purely medical standpoint, you can go right into it afterwards.
Okay, good to know. Um, I can't think of any other questions that I want to know, but we do have some questions, and if there's anything else that you think we should know, we would love to hear. So you tell me which first. You want to continue or you want more questions from the
No,
crowd?
let's answer the questions from the crowd, and then I could add any other points if they weren't touched on.
Okay. Do you see them?
I don't see them.
Okay, so not really on topic, but somebody asked, can one conceive naturally with endometriosis?
Yes, absolutely. So for endometriosis our field is very good at having things that sound very similar but are meaning different things. So we talk about something called endometriosis and also something called endometritis. Endometriosis is when the cells that normally live in the lining of the uterus, what builds up and sheds every month when you get your period, when those cells live outside of the uterus. So they can be in the ovary, they could be on the bowel, they could be on the outside of the uterus. There are actually cases where it can migrate into the brain, it can migrate into the hand. So that's
Oh,
endometriosis. Yeah. So in cases of endometriosis, that can be a cause of infertility when it causes scarring of the fallopian tubes. But in many, many cases, it has no impact on fertility at all.
okay. And then we have one more question. Um, can removing a polyp in the uterus with endometriosis help natural conception?
Yes. Basically, everything you can do to help the uterus get to a normal state can help with natural conception. A way that I like to think about things in medicine in general, but especially in fertility care, is that there's normal and there's abnormal, but there's not a better than normal. And so the evaluation has to really be a careful one, largely guided by the patient's history, actually, to help navigate some of the more unusual cases. So there's a general workup, and then the history helps guide. And based on that, you try to identify where there's a problem, where there's a hurdle, and correct it.
Is there any connection between endometriosis and recurrent implantation failure?
It's such a controversial topic, and it's a
Oh,
great question. There was a paper published about 2 years ago by Lauren Bishop when she was at the NIH. She's now at Columbia. That was showing that endometriosis, when there's no tubal disease, there's not a higher rate of infertility or miscarriage. It is a tough area though, because there's another condition that can go with endometriosis. The two of them go together, called adenomyosis. And not to confuse things too much, but endometriosis is when those cells are outside of the uterus. Adenomyosis is when those same cells, the things that build up and shed when a woman gets her period, grows in the wall of the uterus. And what that means is that an embryo can implant, but what's right underneath where it's implanting, instead of being that healthy muscle of the uterus, is this inflamed tissue of the adenomyosis. And that is a very big cause of pregnancy loss. The two of those, endometriosis and adenomyosis, sometimes go together. So pure endometriosis, where it's just a few spots inside the pelvis, may not play a role, but adenomyosis, when it's in the wall, can. And the two sometimes can migrate together. So people think, oh, I had endometriosis, why I had this. It was no, you had endometriosis and you also had adenomyosis, and that's why this happened.
hmm okay. Anything else you want to add? There aren't any more questions. Oh, wait, some more popped up. Hold on. Um, can you speak about egg banking? If you have one or two frozen embryos, should you wait or do another retrieval?
A lot of that depends on what the couple's long-term goals are. So in a perfect scenario, it's helpful to think that for every 2 to 3 genetically normal embryos, God willing, you'll have a child. And so if somebody wants one more child, I'd usually say if you have one or two embryos, just use those. But if someone says, no, I'd like a family of 4 or 5 or more, then the concern isn't that the embryo you're going to transfer will work. That's when it works, that's when you'd actually be in the problem, because it works, you get pregnant, you have a healthy pregnancy. It might be another 2 years till you're ready to try again and make more embryos. And by then you're 2 years older and it becomes more
The
difficult. So
quality
depending
goes down as you
the
age.
number, right, the number and the quality decrease as you get older.
Something
So
to look forward to.
that's where, and that's actually where you see how far the field has come. We used to be at the point where you need 2 to 3 IVF cycles to be able to have one child. And now in the high prognosis patients, you can sometimes get many from one IVF cycle that could be used down the road. But you see why this area is so fraught with challenges, because people hear these great stories. They hear, oh, I went through IVF and I was able to have 5 kids from that one cycle. And then situations come up like Audrey's where it's just heartbreaking. There's something else that's going on and it's so unexpected and it really throws you for a loop. So you see there really is this broad spectrum in terms of how it could uh, play out.
Okay. 1 second. Um,
I see a comment here. Cervices have fluid from previous C-sections. Right. So that was what we were talking about with the isthmus seal. So when you think about it, an embryo should implant inside the uterus. It shouldn't implant in the fallopian tube. It shouldn't implant in the cervix. So those structures, the fallopian tubes and cervix, make fluids that are not hospitable to an embryo implanting. That's a good thing. But when there's a blockage or some problem with how they communicate with each other, and the fluid goes from one to the other, from the cervix into the uterus, from the fallopian tube into the uterus, that's a problem.
Somebody wants to know if age has anything to do with implantation failure.
It does. It does for two main reasons. The first is that as one gets older, or as one's eggs get older, and that's important because if someone froze their eggs when they're younger, those are younger eggs. So as eggs get older, they're more likely to have genetic abnormalities on them, extra missing chromosomes, and most of those embryos won't implant. So if you take a genetically abnormal embryo, most of those times they don't implant, or they implant and fail very early. So as one gets older, the likelihood that they're abnormal increases. Now, if you do genetic testing, like we talked about, you've overcome that area, but then you get to the second area called egg quality, and that also declines. And that's what we were talking about, where the egg has to repair the damage in sperm.
Right.
Even healthy sperm have some damage. Even in the case of a normal sperm, there's a lot of stress on that early developing embryo. That's a lot of work for the egg to have to do. And so that also becomes more difficult. And that's where trying to reduce the stress, for example, even the biopsying of the embryo, that's a stress on it, pushing it that long, freezing it and thawing it. These are all things that sometimes are absolutely critical and necessary and the right thing to do. But it's important to think through every single step to say, okay, we're putting a stress on the embryo. Do we need to? In many cases, the answer is yes. If you're screening for a genetic disease, you have to biopsy the embryo. You have to push it to day 5. In some cases, if it's male factor, you have to do ICSI. In others, you don't. You can let the embryo just go to day 3. You can transfer it fresh. You don't have to freeze and thaw it. So just to really sort of be thoughtful about each step and do what's necessary, but don't do more.
Okay. And we have two or three questions that we definitely answered already. So I just want to tell everybody that this will be available to watch again after the live is over. It will be saved and it will also be made into a YouTube link. So don't worry, you could go back, you could replay, you could listen. And I do believe a few of the questions left over were already answered. And I want to just ask you one last thing. Let's just talk not as Dr. Williams. Let's just talk as a man. Usually it's all women watching. Can you just speak a little bit about the emotional fallout of implantation failure? Do you have any type of strength you could give us, words of encouragement, words of advice? Maybe you could speak as a husband, like what other husbands should do.
It's
It's a
a it's
loaded
a
question.
it, but it's such an important question. I think for many who aren't going through it or who haven't gone through it themselves, it could be dismissed because they'll say, well, you didn't get pregnant. It was just an embryo that was transferred. They don't realize that, no, that was your baby. That's what you saw happening. That's what you envisioned. And it's an absolutely heartbreaking and heart-wrenching situation. And in many ways, you lose something tangible, right? There's not something to test. There's nothing there. It just didn't work. And there's so many questions. You don't know, is this just a normal situation where 40% of the time or 30% of the time implantation doesn't happen? Or is this just in the beginning of something really long? So to have one fail and the next one succeeds, that's great. And it was so good when we heard Audrey's story, we hear how it ends. But when you're at the beginning of that story, when you have that first implantation failure or that first biochemical, you don't know, is this the first of how many will I ever get to that end? Like if you sort of knew, okay, it'll be 7 transfers and then we'll have a healthy baby,
Right.
that'd be so different from just the unknown that keeps going over and over again. So I'd say just to be supported by the groups and the families and those who around you who can support you to understand that what you're going through is completely healthy and normal. It's something that you have people around you to support you through. And the good news, really, if we could end, in the vast majority of cases, the underlying cause is found and the success rate's actually very, very high. Sometimes it can take a while to find the issue, but the long-term prognosis is excellent.
Oh,
And so to stay
I love that
strong,
message.
yeah. So I think
That's very
that's,
encouraging.
thanks.
That's very encouraging. Really, thank you. Thank you so much. I know it wasn't easy to give us so much of your time, but we really appreciate it. Um, and I hope that this live resonated with everybody watching, and you know where to find us. And if you have any questions, you can shoot them in an email. We could even try to get some more answers from the doctor. If we didn't answer all your questions, we can forward the email for you and make the connection. Thank you again. Have a great night.
Thank you. Good night.
Okay.
Take care.
Good night.
Be well, everyone.
Be well.